Plague. Caused by the bacterium Yersinia pestis, plague spread through infected fleas, animals, and sometimes respiratory droplets. In medieval Europe, the disease could move through communities with terrifying speed. A person might first develop a sudden fever, chills, weakness, and severe headache. Painful swollen lymph nodes, called buboes, could appear in the groin, armpits, or neck. As the infection entered the bloodstream, the body could begin to shut down. Confusion, bleeding beneath the skin, extreme weakness, and shock could follow. In the most severe cases, death came within days, often after multiple organs began to fail. Smallpox. Caused by the variola virus, smallpox often began with several days of high fever, severe headache, back pain, and exhaustion. Then the characteristic rash appeared, first on the face and mouth before spreading across the body. The spots gradually became deep, painful pustules filled with fluid. As they spread, swallowing and eating could become difficult, while fever and dehydration continued to drain the body. Severe cases could cause bleeding and widespread damage to internal organs. Before vaccination, smallpox killed millions of people over the centuries, and surviving it could leave permanent scars or blindness. Malaria. Malaria comes from parasites transmitted by infected mosquitoes, and some species can turn a seemingly ordinary illness into a medical emergency. Fever, chills, sweating, headache, and intense weakness often come in cycles as infected red blood cells are destroyed. In severe malaria, the parasites can interfere with circulation and reach the brain. Confusion, seizures, unconsciousness, and coma may follow. Severe anemia can make even simple breathing exhausting, while kidney failure, low blood pressure, and organ damage can develop. Without treatment, the final stage can involve loss of consciousness and failure of vital organs. Typhus. Typhus is a group of bacterial diseases, and epidemic typhus was historically spread mainly by body lice living in crowded and unhygienic conditions. It became especially dangerous during wars, famines, and imprisonment, when large numbers of weakened people were forced together. The illness usually brought a sudden high fever, severe headache, muscle pain, and overwhelming weakness. A rash could spread across the body as the infection damaged blood vessels. In serious cases, the brain could become affected, causing confusion and delirium. As circulation deteriorated, pneumonia, shock, and organ failure could develop, sometimes leading to death within days or weeks. Tuberculosis. Tuberculosis is caused by bacteria that most commonly attack the lungs, and unlike many rapidly fatal infections, it can slowly destroy the body over months or years. A person may begin with a persistent cough, tiredness, low fever, night sweats, and gradual weight loss. As the disease progresses, breathing becomes increasingly difficult and the lungs can become severely damaged. Coughing up blood may occur in advanced cases. If the infection spreads beyond the lungs, it can attack the brain, bones, kidneys, and other organs. Before effective antibiotics existed, some patients became progressively weaker and thinner until respiratory failure or another complication ended their lives. Dysentery. Dysentery is a severe intestinal infection that can cause repeated diarrhea, often accompanied by blood, mucus, fever, and painful abdominal cramps. Throughout history, it became especially deadly wherever clean drinking water was difficult to obtain, including armies on campaign, besieged cities, and crowded settlements. The greatest danger was the enormous loss of water and electrolytes. As dehydration became severe, thirst and weakness could give way to dizziness, confusion, and falling blood pressure. Eventually, the heart and other organs could struggle to receive enough blood. Without clean water, fluid replacement, and effective treatment, a severe case could progress from intestinal illness to shock and death.